Hello, I'm David Dausey, and welcome once again to the Dausey File. In this segment, we're going to talk about a project that Mercyhurst University is engaged in to increase the ability of children around the world to have mobility. Right now, there are millions and millions of people around the world with disabilities. The World Health Organization estimates that 655 million people are disabled. 20% of those people who are disabled in developing countries are amongst the poorest people in the world. 1 in 10 children has a disability, and of the children with disabilities, only 2 to 3% of them in developing countries can actually go to school. One of the reasons they can't go to school is that they don't have a way to get to school because they don't have access to a wheelchair, they don't have access to a mobility device that will help them get to school and to help them to learn. Because this is such a serious problem and because it affects so many people around the world, we decided to work on a project that had 3 different goals. The first goal was to try to identify what was causing disability amongst children in the world, and in particular in developing nations. We know that there are a large number of disabled children in developing nations. Actually, we don't know how many disabled children there are in developing nations, but we know the number is large because data really isn't collected adequately on disabilities and people with disabilities. So we want to understand how big is the problem, what are the sources of the problem, and how do we stop it. The second thing we wanted to do was to try to provide mobility devices such as wheelchairs to as many children in the world that needed it. And there were a few problems here. A lot of groups are going to developing nations, for example, and giving out wheelchairs to children in need. The problem is that many times these children use the chairs for a few months, they break the chair, and then they're back to the same problem they started with. So we wanted to really understand how do we make it so that we can reach an equilibrium where the total number of children in a region that need a wheelchair can have access to one, and so that we can constantly repair and fix those wheelchairs along the way so that a child never goes through a period where they lose their mobility that they've just earned by getting a donated wheelchair. The third part that we wanted to do in this project was really to try to make it so that donated wheelchairs and mobility devices were given to children to maximize their mobility. Sometimes a child is given a chair that isn't necessarily ideal for their disability. It hasn't been modified at all to take into account their unique circumstance, and so the wheelchair has limited utility to them. So we want to maximize that utility. In order to help us do all of this, we've been working with the Benter Foundation, the University of Pittsburgh's Department of Rehabilitation Sciences, Teleton, which is a group in Latin America that provides rehabilitation services to disabled children, and several others. And the goal of this project has been to really increase the lifelong mobility of children around the world. So we've been working on a pilot project right now in Guanajuato, Mexico, which is in the center part of Mexico. It's a few hours north of Mexico City. Guanajuato is an ideal location because they have a Teleton center there that is ideal for the type of work that we are trying to do. And we would like to make it so that there are no disabled children in Guanajuato in need of a wheelchair. So what we've done is we've worked with the Teleton center there, and we've created a repair depot where the wheelchairs can come in and actually be repaired. Now, this sounds like it's not that complicated, but it turns out to be quite complicated. First, we needed to find a space in the center where we could create the repair depot, and so we had to find funding for that, and we had to actually build the repair depot. Then we needed parts and supplies, and we needed tools, and so we had the Benter Foundation supply funding for the tools. We had the Rotarians in Springdale, Arkansas, who are wonderful people, provide us with the parts. And now we have a fully functioning repair depot at this center in Guanajuato. Our goal is to make it so that we can replicate that center at every Teleton site in Latin America, and there are quite a few of them. There are 19 alone just in Mexico. And if we have this model that is disseminable, that we can use in other places, we are hoping to make it so that children around the world can have access to these depots, so that if something happens to their wheelchair after they have a donated wheelchair given to them, that they can have it easily repaired. This is a great project for Mercyhurst. It involves service learning for our students, and it also involves the ability to directly engage with people from around the world. I'm David Dausey. Thank you for listening. This concludes this episode of the Dausey File.